Shastry. Madam is Professor and Head, Department of Immunohematology and Blood Transfusion, Kasturba Medical College, Manipal. Madam is also Coordinator of Center of Excellence in Immunohematology. She is also Secretary of Asian Association of Transfusion Medicine, Indian chapter. And to her awards and accolades, Madam has received Harold Gunson Fellowship by International Society of Blood Transfusion, the Young Scientist Award by Indian Society of Transfusion Medicine. And to her name, Madam has more than about 90 international and national papers published and taken over. So over to you, Madam. We are really happy to have you to discuss about quality indicators in transfusion medicine. Over to you, Madam.
Thank you. At the outset, I would like to thank CAHOS and also Asian Association of Transfusion Medicine for this wonderful opportunity. I would like to share my slides now. Are my slides visible?
Yes, ma'am. Can we go on slide mode, please?
Yes.
Yeah, thank you.
Okay, so for the next 15 minutes, we will be discussing about the importance of quality indicators in transfusion medicine. Over the past 2 decades, if we look at the quality consciousness, the quest for safe blood has increased tremendously, and transfusion medicine services need to show a concrete proof now for the stakeholders that they meet the expected degree of quality. And the expectation is quite high from for the patient care or from the end users, and it's also beneficial in terms of legal aspects or to get accreditation and certification. Quality indicators are not only proof but also a tool to monitor the various aspects and to improve the quality of performance in an organization. So, what is by definition? Quality indicator are objective quality measures of some of the key potential quality concerns and the risks, and to monitor the changes over time. Now, if we look at the various aspects of quality indicator, it covers entirely vein to vein. The transfusion medicine services as such, if we look at the evolution of quality indicators or the quality concept, there is a long association with the blood establishments. In 1960s, it was all about quality control, whereas we spoke about proficiency testing and quality assurance in 1970s and 1980s, and about quality management system in 1990s, and in around 2010 and 2011, the ISBT Working Party on Quality Management has introduced the concept of quality indicators, which is a major tool of quality management system. Now let us look at this scenario. We monitor several quality indicators at our center, and one of them is component QC failure. So this is calculated as a ratio of number of component QC failures to that of the total number of components tested. So as you can see in this chart, most of the time it was within the expected limit, that is within the 2 standard deviations of our average. Whereas in one particular month, the percentage was much beyond the cutoff value, and it was around 3.4%. Now, as Dr. Shivram has already explained, how to analyze this, we cannot just take it lightly. We further did a root cause analysis of this problem. Here, the problem statement was QC failure, that is, in particular, single donor platelet apheresis product QC failure. So we focused on 4M, the 6 M's, and also the various factors that contributes to this kind of problem. This is the fishbone diagram or the root cause analysis that we have performed, where we analyze the factors related to the personnel, consumables, the environment, the methods, and also the equipments. Finally, we got to a conclusion that this particular QC failure was due to the equipment failure, where we used a 3-part analyzer to do a quality control of the SDP products, and that particular equipment for some time it failed the calibration to count the platelets, especially with high concentration. It was much beyond the linearity of that equipment. And this is how we can pinpoint the problem by doing root cause analysis, which was triggered by monitoring the quality indicator. So the main objective of quality indicator is to provide a fast and simple insight into the quality of the products or the services. It recognizes the patterns over time. It helps us to identify the weak chains in the process. It helps in the selection and prioritization of the issues that needs to be addressed, and also assesses the efficiency and the corrective measures that we take, and helps us to compare with different institutes or different transfusion services, and thus in benchmarking. And definitely it's important for process of accreditation or getting the certification. There are different characteristics of the quality indicator, mainly the objectivity. It should be measurable, it should be quantifiable, and its relevance. Quality indicator should cover the relevant events and the problems. Its use should be relevant for the services or the goal of our department. And there should be a clear numerator and clear denominator. The reliability of the data and the uniform collection of the data should be there. The indicator should be closely related to the problem that are monitored, and thus it should be valid. So when we talk about the implementation of quality indicators, we go stepwise. First of all, we need to select the quality indicator. Next, the development of the quality indicator with defined numerators and the denominators. Then further collect the data which is required, monitoring and evaluating the data that we have, analyzing and interpreting, and thus we can improve our services. So when we monitor these quality indicators, we can also analyze the retrospective data or go prospectively over 1 or 2 years and come up with our own cutoff points or the average for the data interpretation. Initially, when we define the numerator and denominator, further we calculate the mean and the standard deviation of those values. So the limits can be set up to interpret this data. For critical quality indicators, generally plus or minus 2 standard deviation is taken as the cutoff limits, whereas for non-critical quality indicators, we can even consider 3 standard deviation. And these data can be presented in the form of various charts, especially the control charts are very useful in interpreting the quality indicator data. Now, how do we identify these quality indicators for a transfusion services? Based on the Donabedian model, where we look into the structure, that is the physical and organizational characteristics of a healthcare system, and it is mainly based on how the processes are organized. The next is the process as such. So, how the activity is actually performed, and finally the outcome of that activity, the effect on the healthcare, on the patient status, the patient blood management, and whether appropriate results have been achieved. So these are the three important measures that we need to consider, and based on that we can select the quality indicators. When we select quality indicators, it should be directly aligned to the goals and objective of our transfusion services, and it can be measured easily and compiled, quantitative, and it should be actionable and contain accurate data to act upon. Target should be achievable. We cannot have high expectations, and it should cover all the critical control points and the key elements of our entire transfusion service. So what do we mean by control points? The critical control points are those major processes that have to function properly if quality outcomes must be obtained, whereas the key elements are the operational steps that lead to critical control points. And this is very well explained in this particular manuscript, where they have come up with a unique approach to identify the critical control points, the corresponding key elements, and the potential quality indicators for transfusion services. They have mainly identified three important operating systems, and 17 critical points under these three operating systems. The first one is blood collection. So under blood collection, we have 4 critical control points: the blood collection equipments, donor identification, the donor phlebotomy, and the post-donation events. Following that, the critical control points, we have key elements, and related to those key elements, potential quality indicators are very well defined. The next operating system is pre-transfusion compatibility testing. Here, the important critical control points identified are the recipient positive identification, the specimen collection, labeling, sending the request, performing ABORH or the immunohematology workup on both the recipient and the donor, and finally the selection of the components. So based on these steps, the quality indicators are identified in this section. And finally, the third operating system identified is blood component administration. That is about the delivery and the release of the blood components, the recipient, the identification at the bedside, positive patient identification, detection and reporting of the adverse events, and defining the appropriateness, the rational use of components, etc. This is a very well explained manuscript, and I really recommend all the transfusion medicine specialists to go through this. The next step is data collection. We need to be very strong on this. There should be a standardized data collection sheets. We can use Excel sheets or the templates or the checklist for this, and to ensure the accuracy and uniformity of the data collection. Otherwise, further analysis and the interpretation becomes really troublesome. Even the customized software can be used for this purpose, and the formats we can review on monthly basis and come up with the data. So this is one such example that we practice in our center. We monitor several mandatory and optional quality indicators that are recommended by NABH. And this is one such table where I have shown the average as well as the cutoff values that we could derive based on our retrospective data analysis. So the next target is to have the cutoff values, setting these targets, and come up with benchmarking details. The identified quality indicators should be benchmarked, and this will help us in quality improvement project. Further, how do we monitor our quality indicators? Just mere collection of data is not useful. These quality indicators should be monitored at predefined frequency for the trends and also for the deviations. And appropriate corrective measures and preventive actions are possible when we monitor these quality indicators. And this is possible by use of several statistical tools, and some of them are the run charts and the control charts. I have shown the control chart here with an upper and the lower control limit, and it distinguishes between the common and the special cause variation within the process.
Further, last 5 minutes. Sorry to interrupt.
Yes.
Yeah.
Further, when we identify the deviation, we need to proceed with root cause analysis and the corrective and preventive action. And this can be done by 5Y technique, as I mentioned here, or the cause and effective diagram. 5Y techniques where we keep on asking why questions. For example, if we have noted increased donor reaction, why? It could be due to high reaction at the outdoor camps, but why? It could be due to the humid and warm weather outside. Why? It may be due to dehydration. So this is how we derive come to conclusion by using 5Y technique. And now we have these quality indicators that are well defined, especially by the ISBT working party and the NABH as well. There are several sections under which we have quality indicators. The quality indicators proposed in this particular document, which is given out by ISBT revised in 2023, has got 7 different sections. In this document, you get the description of the quality indicator, its importance, and the well-defined numerator and denominators. For example, for promotion, donor selection, and counseling, we can monitor the planned number of whole blood donations, or planned number of apheresis donations, or donor deferral data, etc. With respect to the blood collection, we can monitor venipuncture failure rate, the failed apheresis procedures, or some deviations like adverse donor reactions, a clot, and poor welding. Coming to the patient services, the wrong blood in tube, the turnaround time, CT ratio, the ABO discrepancies that we have, or the RBC units issued in the emergency settings can be monitored. And finally, with regard to the quality management, we can have the donor complaints or the feedback from the patients, the recall or withdrawal of the blood components once issued, even the donor satisfaction rate can be monitored. Now, how does this monitoring of quality control help in a transfusion service? Here we have experience shared from Spain, where authors have found that some of these transfusion services um, do not have quality indicators, even having a proper regulations on that. And from India, we have the experience shared from Gujarat, where they have reviewed their 4-year data on quality indicators and finally concluded that it is a very good tool, helps in correcting and amending the processes and the system in a blood center. So to conclude, the quality indicators help us to improve our transfusion services, but the successful implementation depends on understanding the system, selecting the indicators, having a good data management system. And effective implementation of such quality indicators are possible only with good leadership initiatives and having a good education and training programs, quality plan, and the risk management strategies. So these are my references. Thank you.